Is sponsored by Fidelity Investments. With annual enrollment in full swing, many Americans feel pressure choosing 2026 benefits. Yet only 1 in 4 near-retirement adults have considered their health care needs. Joining us to discuss what to consider is Andrew Atkins with Fidelity Investments. So Andrew, what should we consider when thinking about and evaluating our options, especially for HSAs?
Yes, it's that time of year again, and health insurance is one of the most important selection folks are going to make during this annual enrollment. And there's a few considerations. So one would be coverage, just looking back at your prior choices to make sure they're adequate for you and your family going forward. 2 is going to be costs. Premiums are going to be important, but also consider things like co-payments, deductibles, and those max out-of-pockets. Be sure your providers are in network and you have access to the professionals that you need. And then lastly, take some time to understand your plan type. So you have your HMOs, you have your PPOs, that high deductible plan. And if it's right for you and your family and you have a high deductible plan, I'd also consider pairing that with an HSA to really supercharge those benefits for you. So an HSA or health savings account is essentially a tax-advantaged account to pay for medical expenses either now or in the future. A great way to remember these is a phrase, tax-free times 3. So your contributions actually go in tax-free. Those funds, if you don't need them right away, can grow through investments tax-deferred. And then lastly, when you take those out either now or in the future, they're completely tax-free for qualified medical expenses. So if you're enrolled in that high deductible health plan, and that's either through your work or if you're an entrepreneur and you're in the open market, it's never too late to set aside some of those savings. There's a few features and misconceptions as well. So when you're electing your options, you'll see HSA, you may also see FSA. And a flexible spending account is something different. Unlike an FSA, your health savings account, you never have to worry about losing those contributions. The account's always yours, so we kind of call it a great travel partner because if you leave your job or you retire, it's coming with you. Your HSA funds never expire. Now also remember that that term qualified medical expenses can mean a lot more than most people would assume. So of course you have your co-payments, your prescriptions, dental and vision, those are covered, but a lot of people don't realize everyday items like sunscreen, over-the-counter medications, those are included. And the benefits don't stop with you. They can actually provide benefits to your family too. So if your spouse needs a new pair of glasses or you've got an overdue trip to the chiropractor, or if you're like me and your daughter in 2 weeks has to get braces, an HSA has you covered. So I kind of like to look at an HSA almost like a financial first aid kit. Whether you need a Band-Aid or you have a broken arm, it's a great way to cover those expenses. Take the time to understand your options, and a great resource is our website, fidelity.com/myhsa.